You're listening to the Animal-Free Labcast, the podcast that puts humans, not animals, at the heart of medical research. Welcome to the Animal-Free Labcast, everyone. I'm back here again with Dr Gemma Davies. Hello, Gemma. How are you?
Hi, Carla. I'm good, thank you. How are you doing?
Yeah, not too bad, thank you. Tell us what we've got lined up in today's episode.
So today we're going to be joined by Dr Adjanie Patabendige from the University of Derby, and she is working on developing an animal-free model to study the link between irregular heartbeat and risk of dementia.
Wow, clever woman.
Yeah, very interesting project.
Yeah. Okay, I don't know that I was aware there was a link between irregular heartbeat and dementia, so it'd be really interesting to listen to Adjanie, see what she's got to say about that.
That's it, exactly.
Okay, well, before we get started with that, remind us of last week's poll question, Gemma.
Yeah, so the question was, did you know that even though there are animal-free alternatives, gelatin and other meat industry byproducts are still widely used in medical research? Yes or no?
So do people know?
Well, no, not really. So 60.6% of people said no. So 39.4% of people did know that. So I think it was quite eye-opening for some people hearing Sam on the last episode.
I'm not hugely surprised to hear that. I think before I started working here at Animal Free Research UK, I would not have thought that. Not that it was that high.
Exactly.
I remember saying to the team back then, well, why can't we just say that research is vegan? You know, if it doesn't involve live animals, surely it's just vegan. Yep. And I was met with kind of like, no, it's not that simple. And I was like, why?
No, unfortunately not. Yeah. So, and that's it. And most people just assume gelatin is to do with food. You know, that's where you kind of usually come across it.
Trifle.
So, yeah, exactly. So, yeah. But, you know, people are working on alternatives. So it's brilliant. So there we go.
We're getting there.
How have you been, Carla?
Honestly, not great. So people who follow our social media will have seen our beloved Herbie, bless him, who is the inspiration behind Herbie's Law. He passed away in June, just after his 15th birthday. I haven't really felt able to talk about it before now. Because, you know, he's not just the inspiration and the face of Herbie's Law. He's, you know, he was so much more, you know. So that's been quite hard. But I wanted to just mention it because if people have seen, you know, I've just been overwhelmed with the lovely messages of support on social media. I know that, you know, so many people have been through this many times. So we just keep doing it to ourselves, don't we? But obviously, you know, a lovely thing is that his legacy does live on in Herbie's Law, which was inspired by his journey. You know, he had a great big tattoo in his ear, which is a symbol of the life that he, you know, he narrowly escaped because he was born to be used in research, but fortunately was never used and fortunately found his way to our family. You know, he was one of the lucky ones and he had a lovely life. You know, we had 10 years with him. And with your support, you know, with the Herbie's Law campaign and with all the brilliant work that we're doing with that, you know, we're making, you know, trying to make a world where that luck is never needed again. So it's been rough and I'm sure many of our listeners will, you know, have personal experience of that.
Yeah, of course. And we were all so sorry to hear about it, Carla. You know, he was such a lovely boy. And, you know, he, like you say, he was one of the lucky ones. He had such a brilliant life with you. So,
he did.
You know, he's left an amazing legacy behind and it's incredible, but still very sad for you and your family.
Yeah, we miss him all the time. He's such a big presence. The house is very quiet without him. But
yeah, I can imagine.
Life goes on.
Yeah. Well, you know, like you said, he's left an incredible legacy behind, and we have had a really massive achievement recently. On Monday, the 15th of September, MP Chris Hinchlift asked an oral question about Herbie's Law that we supported him to put together for Home Office Question Time. So have a little listen to this.
Thank you, Mr. Speaker. More than 1.6 million animals have been approved for testing over the next 5 years, including licences for invasive brain research on monkeys and looking at different methods of killing animals in laboratories. Labour's manifesto committed to phasing out animal testing. Can the Minister reassure me that the non-animal methods strategy will commit to Herbie's law and provide a clear framework to phasing out animal experiments within the next decade?
Minister. Mr. Speaker, I'm grateful to him. Herbie's law is a proposed legislative framework to phase out animal experiments, specifically in medical research in the UK, by 2035. The government's commitment is clear. We will partner with scientists, industry and civil society to work towards a long-term goal of phasing out the use of animals in scientific research and testing. And I will ensure that the honourable member receives a letter from the relevant minister.
Oh, isn't that brilliant? Oh, and just love it hearing Herbie's name in Parliament. It's amazing.
I know, isn't that fantastic? So that was Chris Hinchliffe asking the question, and the Minister responding is Dan Jarvis MP. And there was actually such good timing that because this was asked on the day before recess, before everybody goes off for the party conferences. So hopefully that means it'll be fresh in all the MPs' minds as they go to conference, and they'll be really keen to have conversations with our public affairs team who are going to be at all the conferences to find out more about Herbie's law.
So.
But just to give you some background on that question, what he's talking about there, the 1.6 million animals figure came from the non-technical summaries that I've been talking about in the past few episodes. So those animals were approved for use between April and June this year, and they will be used in experiments over the next 5 years.
Just dreadful.
So,
absolutely dreadful.
yeah.
And especially when we've got a government commitment to phase out animal experiments, it's really shocking.
Exactly. Yeah, so to bring it to their attention, that number really does make the point, doesn't it?
Yeah.
But I think the fact that Chris even asked that question on our behalf is really amazing, because the process of actually being able to get up and stand and ask a question like that is really long and convoluted, and it involves a massive element of luck,
It does.
actually,
yeah.
weirdly. So if you're not aware of the kind of process to get a question asked like that, an MP has to enter a monthly ballot to ask if they are able to ask a question, and they submit the question, and then it's like a lottery. So if they actually get chosen, but if they do get chosen, which is quite unlikely because, it's really competitive, pretty much every MP puts in a question, and especially for the Home Office, because they answer questions on so many different topics. Not only do you have to get chosen, it depends what order you get chosen in as to if they will actually get to your question on the day. So, for example, the week before Chris's question was successfully asked, Steve Race, the MP who did officially introduce Herbie's law last year, was chosen for DSIT question time, but he ended up being 8th on the list. So they didn't actually get to him on the day because the session is only an hour long. So they ended up giving him a written response instead.
Still good.
So
Still good.
It's still good,
Yeah.
of course. Yeah, but didn't get to stand up and have that moment. But Chris was lucky enough to be second on the list, so they did actually manage to get to his question. And, the thing that's so amazing is that Chris really could have talked about any topic.
Yeah.
There's so many huge topics going on at the moment, but he chose to talk about animal testing, and specifically this number of animals that have been used or approved for use over the next 5 years. And then in his follow-up question, he asked about Herbie's law, which is incredible. So, these questions are submitted beforehand. So that means that the minister and his team will have had to go away and research their answer. That means they will have had to look into what Herbie's law is and read the bill. So it's a really incredible opportunity to bring it to their attention. And we're just so grateful to Chris for doing that for us. It's an amazing opportunity to talk about Herbie's law and bring it to all the MPs' attention just before the conferences. So we're really excited to see how our teams get on there talking to all the MPs.
Absolutely, yeah. And so important that our supporters are there kind of plugging away and bringing this to their MPs' attention, because this is the thing that, you guys can get it in front of your MP, and then MPs like Chris will stand up in Parliament. I mean, brilliant. Thank you so much, everybody.
Yeah, it's fantastic.
Well, let's talk to Adjanie now, who is doing some incredible work looking at the link between irregular heartbeat and the risk of dementia. So welcome, Adjanie. Thank you so much for joining us.
Hi, Carla. Hi, Gemma. Thank you so much for the invitation.
So tell us about your work, Adjanie. What are you researching at the moment?
Okay, I'm researching the blood-brain barrier. So I think I'll start off with explaining what the blood-brain barrier is.
Please, yes.
It's a barrier between the blood and the brain in simple terms. So this barrier is made up of cells that line the smallest blood vessels in the brain. And they're tightly packed, so they're different to blood vessels of other parts of the body. So it doesn't allow anything to get across from the blood side to the brain side easily. So it's protecting the brain. So things like viruses, bacteria, toxins can't get across the blood-brain barrier into the brain. So it protects the brain.
So super important then.
Oh, yes, very important. But there's an issue with it being so tight as well. So, for example, for conditions like, dementia, Alzheimer's, Parkinson's, stroke, so on, it's difficult for drugs to get across this barrier because the barrier thinks it's something foreign, something toxic, so it doesn't allow it to get across.
So is that part of the problem in finding effective treatments for those conditions, Adjanie? Because the ones that you've listed there, Alzheimer's, dementia, Parkinson's, are some of the ones that we can least successfully treat, I think.
Yes, because even if you discover a drug that could treat these diseases, getting it across the barrier is very difficult. The only other way is basically drill a hole and then get it in, which you can't do, obviously.
Nobody wants that.
No. So we have to find ways to deliver the drugs across the barrier as well. So scientists are looking at ways of delivering these drugs. So not only we have to look at how this barrier is disrupted in these diseases, but also even with this disruption, it's still difficult to get drugs across the barrier.
I'm sorry, I just went off there in thinking about, I was just been watching this show called Severance on Apple TV, and they literally were drilling into people's brains to insert a little chip into them. So horrible.
Yeah.
So horrid.
Yeah, we can't be doing
No,
that.
we can't be doing that.
No one wants that.
So how do people usually study the blood-brain barrier?
Okay, so we use both human and animal methods in generally. In terms of human methods, so we have to use human cells because obviously it's in the brain, so you can't use actual humans to study the blood-brain barrier. And because it's a cellular structure, it's difficult to look at the detailed mechanisms of how this barrier is damaged in an animal model or even a human. So using human cells is the way to go to look at the detailed cellular and molecular mechanisms to help us understand the disease process.
So Adjanie, you're using human cells, right? You're not doing any work in animals. Where do you get those human cells from?
So human cells, we can get human cells from suppliers who get donated human brains, and they can isolate these cells for us to purchase.
So is that donations from people who have had like brain tumours, and so you're getting some of those cells?
Could be that, or people who have met with a road traffic accident. It could be from people like that.
So when someone's donated their body to science.
Okay.
Yes, yeah. In terms of getting cells from people with brain tumours, it can be done, but sometimes the tumour cells grow more than the normal cells, so and you can only get a tiny amount, so it's not feasible to actually
It's not really reliable.
Yes.
So they're very precious cells then, these cells that you're working with.
They are very precious, and we are so grateful for everybody who has donated this. Without their donations, we would have no alternative than to sort of look into other ways. There are other ways in terms of induced pluripotent stem cells. So these are cells that we can grow in the lab. So we can convert normal cells from another part of the body into human brain endothelial cells to grow this. However, using cells directly from a human brain, a human capillary, would let us replicate the human condition better.
I just want to interject there because human-induced pluripotent stem cells are basically magic. I mean, they're incredible. You can take any old cell and kind of reprogram it to become any other cell. It's just, mind-blowing.
Yes. Yes,
That's amazing.
they are amazing, but you have to be very careful to make sure that they have the endothelial, this is the blood-brain barrier features in those cells, because you don't want to assume that they have the feature and then end up having some other, for example, epithelial origin cell. So again, you have to be very careful when dealing with a blood-brain barrier model.
So one of the really important things people can do at home, if they want to, is make sure that they're registered with the organ donation registration, because this is really helping to save animals' lives, because they're not being used in research, because you can get the cells from humans instead, and human lives, because your research is going to be so much more applicable to humans if you're using human cells. So Adjanie, tell us why using human cells is so much more scientifically effective than using animal cells.
Yes, so if we get an example from the blood-brain barrier, there are differences in transporters. So these are molecules that can take certain things across the barrier from the blood to the brain. There are differences in human cells and animal cells. So if you test something on an animal cell, you would assume that, it can get across the barrier or it is therapeutic. But then when you go on to test this in humans, that drug would not get across the barrier. So you wasted testing on so many animals, and then you wasted so much money on a clinical trial on a drug that can't get across the barrier. So it's very important that you make sure that the drug is tested on a human cell.
So and that's because the blood-brain barrier in humans and animals is working differently in important ways.
Yes, in important ways. Transporters can be different.
So that's the work that you've been doing, looking at the blood-brain barrier using the human cells. But your work also brings in looking at the effect of irregular heartbeat. So can you explain to us how you're doing that as well?
My research stems from recent evidence that suggests there's a link between heart disease and brain dysfunction, so specifically cognitive decline and dementia. We do know that irregular heartbeat or atrial fibrillation can link to 5 to 6 times increased risk of stroke. That's known.
Goodness.
Well, yes, that is known. But what is not known is that in these patients, atrial fibrillation patients, they are now seeing more of dementia symptoms or cognitive decline. But we don't know the exact mechanisms. So remember, I mentioned the blood-brain barrier controls, everything is tight. So anything that gets across between the blood and the brain is controlled. So in these patients, clinicians have found that if you test their blood, they found compounds that are not supposed to be in the blood. So these compounds are meant to be in the brain. So the blood-brain barrier is leaky in these patients.
That's not good. That
That's
doesn't
not
sound good. No.
That's not good. So there's evidence to suggest that the blood-brain barrier is disrupted in these patients with dementia. So my research is trying to find out the mechanisms without using animal models.
And what kind of animals are usually used to study that?
So for atrial fibrillation, mainly small animals such as rats and mice are used, but larger animals such as dogs, horses, rabbits, pigs, goats, so all sorts are used.
And is that because, they're thought to be more similar to humans, or is it because they're bigger?
Yeah, the bigger animals are used because they are more similar to the humans, but the small animals, sort of like rats and mice, are used. Specifically, mice are used because they can be genetically modified. So given the differences between humans and animals, and the fact that it's so difficult to study the blood-brain barrier in detail in animals, these models, we cannot use these models to look at how atrial fibrillation might be affecting the blood-brain barrier and increasing the risk of dementia. To do this, we need to design a human equivalent model that we can replicate this system. So what we are doing is we are looking at developing a human model. So we have a human model with brain endothelial cells grown in a little capillary-like structure, so like a tube-like structure. The whole system is connected to a computer. We can input ECG data from atrial fibrillation patients, and we can control the blood flow. So we have a solution similar to blood, so we can control this blood flow according to the ECG pattern of the patient. And
that's so cool.
I know. Wow.
And look at how these changes in blood flow due to abnormal heart rhythm can affect the blood-brain barrier. The really cool thing about this model is you can take samples from the blood side and the brain side, so we can look at whether in these sort of patients, whether the blood-brain barrier is disrupted. Can we measure the same compounds that those clinicians saw in the blood of atrial fibrillation patients with dementia, to really look at the differences and the changes in the blood-brain barrier in real time?
That's amazing.
That's such a clear way to kind of replicate that outside of a human or an animal. You can really make that connection then for exactly what you're trying to look at. So interesting.
So similarly, if there is a drug that could potentially treat these diseases, we can test them to see whether this drug can get across this barrier, because it's a really tight barrier compared to models made out of animal cells. Because we are replicating the blood flow, we are replicating it using human cells, as well as, thanks to animal-free research, we are developing a fully humanized model using non-animal derived byproduct. For example, I think your last podcast talked about gelatin.
Yes.
We are using human fibronectin when we used to use collagen from rat tails.
Brilliant.
Yes.
That's really good.
Yeah. All of these little changes all add up to make the model human specific, don't they? And it can have an effect on results as well.
Human specific, we're replacing fetal calf serum with human plasma. So it's all the little changes that we do make it a truly human model.
Brilliant. Yeah. So are you working with any pharmaceutical companies or anything to actually test some of their drugs in this, Adjanie?
Not at the moment. I used to, because remember I said about the importance of testing the drugs at the early stages. So once this model is fully validated, that's sort of the next step, to try and test some compounds on the model.
Fantastic. So how far away do you think you are from that, and for maybe some kind of clinical benefit for patients?
It is quite a while away. As you know, scientific research takes a very long time.
It does.
But you have to get it right. I feel at the first time you have to get it right. So once the model is fully validated, we can do some trial runs, probably within the next couple of years, to try and get some trial runs done, to see whether this is something that can be taken forward. And as we all know, AI is now everywhere. So potentially using some AI-derived techniques as well to simulate. There's endless opportunities, basically.
Brilliant. And I love that as well, because it is really important that we get this right. Human-specific research is meant to be about getting breakthroughs for patients. So if you don't get your model accurate from the beginning, you're just replicating the bad old ways, aren't you? Without the animal suffering, at least. But, you're still ending up with something that isn't got the efficacy and the effectiveness and the reproducibility of what is actually happening in a human. So this is really important.
Exactly, like reproducibility and reliability is very important. So just because you are doing a human model, if you are testing on a human model, it's not going to be value for money, or, and it's not going to benefit the patients in the end. So trying to get this right the first time and demonstrate reproducibility and reliability. And again, it's very important for pharma companies as well. They wouldn't want to test something that's giving you different results every time you test it. So
yeah, absolutely.
Yeah. Which is something that you do see in animals, isn't it? That kind of get different results every time. So yeah, that's fantastic.
Yes, yeah.
So how did you get into all of this, Adjanie?
Yeah, it's a long story. I'll try to keep it short. I was an undergraduate at King's College London, studying neuroscience. But after my second year exams, one of the professors emailed few students who did really well in her essay, asking whether you'd like to do a summer project. I jumped at the chance. She was leading a blood-brain barrier group at King's College London. I didn't stop. I went on to do a PhD, and I'm like 20-something years later, I'm still working at the blood-brain barrier.
Brilliant. And we've been so privileged because I think we've funded some of that work of yours over the years, haven't we?
Yes, actually, my first postdoctoral research at University of Liverpool was funded by you. It was called Dr Hadwin Trust at the time. So I'm truly grateful for that. And more recently, a pilot grant and now a transition grant. I'm really, truly grateful for you and the supporters.
Well, we're so grateful for you because, you're one of our success stories, Adjanie. A lot of people don't manage to stay in research or they go off in different pathways. But, we funded a postdoc for you and you're still here many years later, still doing it, still plugging away, still doing human-specific animal-free research. It's incredible.
Oh, thank you. Thank you so much.
Oh, well, Adjanie, thank you so much for joining us. It's so interesting to hear about your amazing work. And we look forward to hearing how you get on in the rest of the grant.
Thank you. Thank you so much. I look forward to sharing my research with you and the supporters. Thank you.
So we'll be back in a fortnight when we're going to be answering all your burning questions about the world of animal-free research. So do let us know what you'd like to know. You can ask us anything.
Yeah, so this time it doesn't have to be a science question. If you'd like to know something about policy or regulations or anything else to do with animal-free research, let us know. You can ask us anything at all. You can email your question in, well, within reason. You can email in at hello@animalfreeresearchuk.org, or you can ask on our socials. So we've got LinkedIn, Facebook, Instagram and X, and we will pick a few to answer in the next episode. And then if you'd like to let us know anything else about your thoughts in the episode, do also drop us an email. And again, the email is hello@animalfreeresearchuk.org.
Brilliant. We'll look forward to reading your questions and seeing what we can come up with. Well, thanks so much for listening, everybody. And we will see you in a fortnight when we'll be back with all the latest from the heart of animal-free research. Thanks, everyone. Bye-bye.
Bye.
You've been listening to the Animal-Free Labcast, the podcast that puts humans, not animals, at the heart of medical research. If you want to find out about more ways to move to a world of animal-free research, then head to our website, animal-freeresearchuk.org. And if you'd like to send us an audio message about the poll or anything else you've heard in the podcast, then leave us a voicemail on 0208 054 9695. That's 0208 054 9695. Thank you for listening.